Welcome back to the series on frequently asked questions in dentistry. I am Dr. Prem and Gold. I am an implantologist who has placed more than 5,000 dental implants, and also I practice under the name Gold Dental. Question of the day is, can implants move? Implants are not supposed to move when they are integrated. To understand this, we should know the basic difference between how a tooth works and an implant works. A tooth is embedded in the bone with a small resilient structure in between the bone and the tooth called periodontal ligament. Whereas an implant is completely integrated with the bone by a process called osseointegration. So a very well integrated implant can never ever move. Having said that, yes, if your implant moves, it can be a failing implant, so that it may warrant a removal. However, it may not be the case in all the time, because there may be the connection between your implant and your crown, which is connected by a small screw called prosthetic screw or abutment screw, which can loosen up, like the screw in your spectacles. This can loosen up and give you a false positive or false showing that as though the implant is moving. So a very integrated implant can never move. If your implants are moving, kindly contact your dentist. Once again, Dr. Prem, your own dental implantologist. Thank you.